Namaskar, myself, Dr. Kamla R. Nagar, Professor and Head, Department of Agattantra Evam Vyavahar Ayurved, Faculty of Ayurvedic Science, JAYOTI Vidyapeeth, Women's University, Jaipur. Today, I am going to share my session for BAMS third year Agattantra. अगतंत्र जैसा कि आप जानते हैं आयुर्वेदिक टॉक्सिकोलॉजी को कहते हैं। इसमें विश्व विज्ञान से संबंधित विभिन्न पहलुओं का अध्ययन किया जाता है। इस संदर्भ में आज हम मॉडर्न टॉक्सिकोलॉजी के अनुसार रेबीज की बात करेंगे। डेफिनेशन: रेबीज आल्सो नोन एज हाइड्रोफोबिया is an acute, highly fatal viral disease of central nervous system caused by rabid animal bite. Causative virus is Lyssa virus. This is a RNA virus belonging to Rhabdoviridae family. Rabid animals which having rabies. Example: dogs is most common, humans, cats, jackal, wolves, bats, cattle, and horses. Source of infection is saliva of rabid animal. Mode of transmission is saliva of rabid animal transmitted commonly by bite, uncommonly by licks, rarely by aerosol and person to person. Pathogenesis as per modern medicine. First of all, rabid animal bite, then saliva along with Lyssa virus in wound, then replication of Lyssa virus in muscle or connective tissues near the site of bite, then virus attached to nerve ending, then virus enters in peripheral nerves, then virus enters in central nervous system, then return again in peripheral nerves centrifugally, act on skeleton, myocardium, adrenal glands, salivary glands, skin, etc. Sign and symptoms as per modern medicine. Local sign is abrasion, lacerated, punctured wound, paresthesia around the bite site due to inflammation of dorsal root ganglion. Systemic signs and symptoms are classified in three phases. First phase is non-specific prodromal phase for 3 to 10 days due to viremia. In this, the patient feels fever, malaise, myalgia, headache, fatigue, anorexia, nausea and vomiting, sore throat and non-productive cough. The second phase is encephalitic phase. Due to inflammation of white and gray matter of brain, the symptoms are excitation, agitation, confusion, hallucination, bizarre, aberration of thought due to motor activity, neck stiffness, positive kerning signs, and muscle spasms, seizure due to meningitis. Third, dilated irregular pupils, excessive salivation, lacrimation, bronchoria due to autonomous nerves abnormality. D or fourth, weakness of limbs, increase of deep tendon reflex and extensor plantar due to upper motor paralysis. Hoarseness of voice due to paralysis of vocal cord. Hydrophobia or aerophobia, it is painful, violent, voluntary contraction of the diaphragmatic, accessory respiratory muscles, larynx and pharynx, which initiated by swallowing or touching of water or liquid or air, due to excitation and inflammation of dorsal root ganglia, which produce hyperparesthesia. Third phase is coma or CNS necrosis. Hypoventilation. In this phase, we found the symptoms like hypoventilation, apnea, cardiac arrhythmia, and death due to cardiorespiratory arrest. Management by modern medicine after rabid animal bite. Local wound care. Wound should be thoroughly scrubbed with soap and then flushed, washed by running water for minimum 5 minutes. In case of punctured wound, catheter should be used to irrigate the wound. Residual virus should be inactivated by irrigation with virucidal agent like alcohol, tincture, iodine 0.1% or pro-iodine. Suturing, if required, should be done after 24 to 48 hours with minimal stitches. Anti-rabies serum should be given locally 10 IU per kg if available. Management by modern medicine. Post-exposure prophylaxis (ARV) anti-rabies vaccine. Indication of ARI is all the bites by wild animals, all the bite by non-immunized animals, all the bites by unidentified animal. If biting animal cannot be traced, unprovoked bite. If animal shows signs and symptoms of rabies or dies within 10 days of observation, then laboratory test FRA test, fluorescent rabies antibody test of Nagari body from brain is done. Dose, route and administration of ARI, purified chick embryo cell vaccine, PCECV. Nowadays it is very commonly used. Rabipur 1 ml per IM on deltoid region at 0, 3, 7, 14, 30 and 90 days. Out of first 3 doses are compulsory and next doses injected in doubtful case of rabies. Second, anti-rabies serum. If signs and symptoms of rabies found in doubtful case, human rabies immunoglobulin 20 IU per kg locally at bite site and intramuscular. Pre-exposure or prophylaxis Rabipur 1 ml IM on deltoid region at 0, 7, 28 dose plus booster dose with 1 year and 5 years. So these are the modern management for rabies. Now, if the patient died due to rabies poison, then what will the postmortem appearance will be? Externally, abrasion, lacerated, puncture wound will be found at white site. Internal, white and gray matter brain edematous. Sign of asphyxia like congested internal organs. Facial HGE will be found. Chemical analysis and microbiology for rabies. Hippocampus 1 to 2 centimeter plus cerebral cortex plus cerebellum and medulla in 50% glycerol saline for Nagari bodies and isolation of the virus is sent for laboratory test. Medical legal aspects are accidental. Rabid animal bites are often accidental, suicidal, not recorded. Homicidal may be found rarely. So this is all about the rabies virus, their clinical sign and symptoms, their clinical management, postmortem appearance, medical legal aspects, and visceral examination or chemical analysis. Vaccination regarding rabies virus are discussed in this session. I think this session will be helpful for all of you. Thanks.